Howdy, welcome to AVS 425, and today you're going to be watching a video on the modality known as hippotherapy. The writer is Winnie. The physical therapist that's doing this treatment is Nancy Hickman. You'll be watching the entire session of about 30 minutes. During the whole session, Nancy and I will be discussing what you are seeing while this is being performed. The horse is Montana. You have a full team of professionals in the session, and probably in a minute or two we will start that discussion. Meanwhile, just enjoy watching Minnie get prepared to start her session.
Just feel like you're barefoot. I am also. Now, I'm going to shift you just a little bit. Okay? Oh, you're a pickle bug. Isn't that nice to sit on? Okay, are we ready? Now, here's what we're going to do today. We are going to sit frontwards and sit sideways, and then sit backwards, and then sit sideways again, and then sit frontwards. Okay? We're going to just go around the world. So that when we get done with these masks, we can put them someplace that either they get thrown away or get washed. And every time somebody comes, they get a clean pad to sit on. And then some of that stuff was sanitizer to spray in the bathroom. All right? What do you say? All right. Let's go 2 times in each direction. Good. Keep your eye open, the horse food.
You're watching Winnie begin the bulk of her physical therapy treatment using the motion of the horse as the treatment. I have Nancy Hickman, who is a physical therapist with us, and she's sitting here beside me and she's helping me explain what's going on during this video. So right now, Nancy's instructing Winnie how to, as she stopped, to go forward. So Nancy, what are you asking Winnie to do here?
I am encouraging Winnie to use both arms to support herself and to sit up straight to keep her chin up. And I'm also asking her if she's comfortable, if we need to change her position in any way, because she is on a bareback pad. And so she doesn't have anything but her core strength to keep her positioned on the horse. The other thing that we have to watch with Winnie is that she has a scoliosis, which means she has a curvature in her spine, which means that she does not sit evenly on her pelvis. So we have to position her a little off center in order for her to actually stay in the center of the horse.
Um, Going backwards from that a little bit, what is Winnie's diagnosis and why is she doing hippotherapy?
Winnie is diagnosed with a condition called spinal muscular atrophy, or SMA. It is a genetic condition. It's actually a chemical condition which causes her muscles not to have the right proteins and components that they need in order to be strong enough to work against gravity. Babies are usually diagnosed at birth or shortly within the first few months of life um, with this condition. It is a neurological condition, but it involves the muscles, the active muscles, not the brain or the spinal cord. So she's a very intelligent, outgoing little girl. She has extremely weak muscles. This is usually diagnosed in a young baby when they start trying to sit up. So they're moving from the rolling and being parallel to the floor stage of development to raising their body against gravity. And if they're able to start doing that in a short period of time, they lose strength, enough strength to be able to continue. One of the miraculous things that has happened since the past about 3 years is they have actually developed drug treatment to help her muscles regain the proteins and the chemicals that they need to function against gravity. So Winnie is in those treatment protocols, and she is actually getting stronger and stronger all the time. When she first started doing this, when she was around age 3, which was about 2.5 years ago, the horse probably would take 5 steps and Winnie would fall forward. So we had to have hands in front of her and hands behind her, and anything that disturbed her balance very much, she would kind of collapse. So you can see in this video that she's able to sit for an extended period of time with just the regular side walking stability at her hips with no extra help.
Nancy, can you go over again why this particular type of treatment, the using the horse's motion, does work well for children like Winnie?
Winnie's, okay, so the basis of motor development and control in all developing infants and young children is core strength. As in typical development, your core around your middle becomes stronger and stronger. A young child, infant develops head control, and then they're able to move their trunk in different directions. And until you have a good, solid, strong core, you cannot walk because you don't have enough strength to keep your core centered against gravity. So your core musculature is the basis for all movement. And
that is the core is profoundly weak in children with spinal muscular atrophy. So one of the benefits of using equine movement as a strategy in Winnie's physical therapy program is that it almost exclusively works on her core strength. Sometimes you might see us during this video, she tends to try to get her elbows up in the air and use her shoulders to try to hold her core still. So if you see me asking her, like right now, she's got her elbows way up in the air, and I asked her to put them down. When her elbows goes up like that, she's trying to hunch her shoulders up and use that to stabilize her core. So we try to get her to put her elbows down and actually just use her core musculature.
Nancy, while we're on this, I'm pretty sure I'm right about this, but is not Winnie's mom instrumental in developing a screening test for
Yes.
SMA, as it's commonly known in the industry?
There are screening tests that have been available for a long time that were used when possibly there was a suspicion that that could be what was wrong with the child, the infant, as a newborn or very young infant. The problem with those screenings were that the child had already lost muscle strength and developed symptoms and lost motor skills. So Winnie's mom was one of the people who were instrumental in getting West Virginia to include screening for spinal muscular atrophy in the newborn screening before the child leaves the hospital. So all infants in West Virginia are now screened for spinal muscular atrophy at birth. The advantage to that is that the sooner these treatments begin, the less muscle strength the child will experience. So it's kind of like a whole new era for any infant. They will be diagnosed at birth, and intervention can start immediately instead of starting after the child has already lost strength and skills.
Well, we've talked a lot about Winnie, but could you give us some information on the horse that's being used in the video today? Her name is Montana. She's one of the On Eagle's Wings therapy horses. But tell us a little bit about your training as someone who does therapy using the horse's motion. Why you would select a horse in particular like Montana for Winnie, and in general what you learned about selecting horses.
Okay, so as a physical therapist, we are looking to help the child achieve certain outcomes. And we use the horse's movement to do that. So we are going to look closely at what an individual horse offers in the way of movement. So Montana has a very nice, elongated gait. She's smooth. She's not terribly concussive with her feet, and she's symmetrical in her movements. And those are all important things for Winnie. We have used horses with Winnie who had a little bit more abrupt starting and stopping, and that's difficult for Winnie to accommodate. So if you have a horse that kind of has a bit of a lunge when they initiate the walk, or a very abrupt halt, that movement and the abruptness of that movement is translated through the child's core and is difficult for some children. Montana has a very gradual start and halt. Winnie can tell that the horse is getting ready to move before the horse actually moves forward, and the horse is just very smooth with doing that, and it allows Winnie to accommodate the movements. With Winnie, with some children, we might want a horse that has more lateral movement or more anterior and posterior movement or more rotational movement as an exaggeration of their gait. With Winnie, we want a horse that's pretty symmetrical in all planes of movement. And that's what we find in Montana.
So, in your development, education wise, how did you achieve the status of registered therapist with Path International with On Eagle's Wings?
Okay, so there's two organizations. Path International is one organization, and the American Hippotherapy Association is a separate organization. The American Hippotherapy Association offers educational courses to give instruction in using hippotherapy or the equine motion as a treatment strategy. After you have taken level 1 and level 2 courses through the American Hippotherapy Association, there is a certification board called, so this is the third organization that's involved, the American Hippotherapy Certification Board. And they now have two standardized tests that can be taken to offer certification in the use of hippotherapy as a strategy. The test that I took is an entry level basic certification. I am certified by the American Hippotherapy Certification Board to provide services using hippotherapy as a strategy. There's also what's called a clinical specialization test, which is one of the things that physical therapists, occupational therapists, and speech therapists can take, kind of like getting an extra bump to your degree if you study and take a specialist examination. So you can be a hippotherapy certified specialist by taking yet another test, which usually involves an additional course of study. And then after you have taken one of those two tests and you're certified by the American Hippotherapy Association, Certification Board, then you can become a PATH International Registered Therapist, which PATH requires their therapists that work in a PATH accredited center to be a PATH certified PT, OT, or speech therapist.
So, while you were explaining the educational piece, um, we're noticing that Winnie is, instead of riding frontwards in a normal riding position, all of a sudden you've placed her sideways. So, tell us a little bit about that.
When an individual is sitting sideways on a horse, you experience a lot of lateral movement. There's some anterior, posterior, but it's actually more rotation. When you're sitting sideways, you're rotating, the horse is rotating its barrel, but you're experiencing that movement anterior and posterior. You'll notice her elbows are way up. This is really difficult if you've ever sat sideways on a horse while someone's leading you. This is not easy. And I asked Winnie if she felt like she could put her elbows down while she was doing that, and she said no. She didn't think she could do it. So it involves a lot of intense core use of core muscles to accommodate that lateral movement from side to side and to remain upright on the horse. So that was a lot of work for her. And now she's sitting backward. And this just helps her also, it changes the position of her pelvis, which changes the way she's using her core muscles. And it's just an additional challenge to her core.
What is normally the duration of a treatment, or as we like to say, a hippotherapy session? Maybe you want to explain a little bit why I'm kind of going back and forth from hippotherapy to talking about a treatment strategy. We kind of alluded to both, but they get a little confusing.
Hippotherapy is not a separate thing. So children who participate in this strategy have a physical therapy assessment that is done that doesn't have anything to do with a horse. It's a clinical assessment They have a plan of care that's developed, outcomes that are developed, and then a list of strategies, which could involve a home program. It can involve any number of things, stretching, strengthening, and using equine movement is just one strategy in a general plan of care in order to achieve outcomes.
So you've told us that Winnie is how old?
5.
5. Okay. So how long have you been working with Winnie, and how did you get involved with her treatment?
She was referred through the West Virginia Birth to 3 program, which is a federal program that is administered through the Department of Health and Human Services, Maternal and Child Welfare Department, and the Medicaid. Although you don't have to be on Medicaid to get this, it's a free program available to any child in West Virginia from birth to their 3rd birthday, for either assessment or intervention. So any child in West Virginia whose parent or babysitter or doctor or anyone has any concern about their development in any area, they can make a referral to West Virginia Birth to 3. An assessment team does a complete assessment of the child's total development and makes recommendations if there is any deficit in any area. If they meet the requirements for the program, then they can receive services, and there's no charge at any time, including if they need assistive technology such as a walker or orthotics or something to help them, um, things to help them with language development, any area of their development. It's a wide ranging program, and Winnie was receiving physical therapy, several different services, but she was receiving physical therapy through West Virginia Birth to 3. She was probably 2.5, and she was referred for. I think her mother became interested in the possible use of equine movement to help her develop her core. And then she has continued. She's obviously out of that program, and they have continued to participate.
So Winnie's now riding at age 5. So
Mhm.
how does she pay for this type of treatment?
So Winnie's family is what we call private pay. There's a lot of different aspects to payment for physical therapy services. Oftentimes it involves insurance companies, which physical therapists who bill insurance companies, including Medicaid and Medicare, have to be in what you call network. In So you have to be accepted by the network of insurance providers, which can take up to 6 months to get a therapist approved as being able to bill, and then you can bill through insurance companies and Medicaid through age 21 if you're approved as a pediatric provider. If you are approved as a provider for people over the age of 21, then you also have to accept Medicare patients, which is a whole new world of paperwork. So, in the current provision of physical therapy services at On Eagle's Wings, we are considered a cash-based service. If parents want to send an invoice into their insurance company for reimbursement, then they would pay upfront out of pocket and then be provided with an invoice that they're able to send into their insurance company for partial reimbursement. Some of them get funding through what's called family support grants. Some of our clients are on another federal program called the Title 19 Waiver Program, which provides extended services for individuals with multiple disabilities. So there's a lot of different funding sources. Right now, ours does not involve insurance.
So primarily you're a pediatric physical therapist, but is the treatment with the use of the horse's motion appropriate for any age individual?
Yes, it is. It becomes, it would look different than this for an older child or an adult. You can use bareback situations for older children and adult-sized people. It becomes a little bit harder to balance the longer your legs are with nothing to balance against, the little bit harder it is to stay centered. Sometimes with adult people, we will use a saddle, especially if they need to work on standing or leg extension strengthening. You can't do that without stirrups. So
We'll close when we get to
it physical therapy using equine movement for adults may look different than what you're seeing here. It becomes more difficult for the horse if you have someone who's 180 pounds. It's kind of hard on the horse for a person that large to sit sideways or to turn around on the horse and be continuously shifting that much weight on the horse's back to ride backwards. So you have to be a little bit more careful about what you're asking them to do, and sometimes a little more creative. Oftentimes, so for instance, we had one adult person who had cerebral palsy. The muscles, she is a person who is able to walk with a different looking gait, and her legs had become very, very tight, and her hips were tight and painful, and she felt like this equine movement would help her get stretched out and be able to walk better and longer. And when she first started doing that, we did use a saddle, an English saddle. She could only sit on the horse for about 5 minutes. So she remained in PT for maybe a year, maybe a little longer, until she could comfortably stay on the horse for 30 minutes. And it took us quite a long time to work up to that, as far as strengthening and her core and stretching. We sent a saddle home with her so she could put it someplace in her house where she could, use it as a way to stretch her hips. And that's been several years ago, and now she is, in essence, an independent rider. And she continues in therapeutic riding now. So she transitioned from physical therapy once she could be, with assistance, mount and dismount and stay on the horse comfortably for 30 minutes. She was able to transition to therapeutic riding. And most people don't stay in physical therapy forever.
And just as a reminder, Nancy, you and I have worked on several therapeutic riding students, because sometimes as a therapeutic riding instructor, we're not quite sure if someone we bring in for an evaluation for general riding here, whether they're more appropriate for someone like Nancy to work with, or actually be able to do therapeutic riding, which therapeutic riding is really adaptive riding, meaning they can start learning riding skills. And then Nancy, you teach no riding skills whatsoever.
No riding skills.
So you could use reins if that was appropriate for that type of.
If we wanted to work on bilateral hand usage, if we wanted to work on symmetry of the upper extremities in the trunk, and we want them to keep their hands up. Let me just point something out here. If you look at Winnie's trunk during this walking, you can see she's got a lot of trunk movement, and she's a little slouchy looking, and her head bobs with every step. So these are all indications that her core is weak. So she's not able to hold everything completely still, and use hip movement to accommodate the horse's movement. The horse's movement is translated clear up through her head. So with every step, every muscle in her core and her head are trying to accommodate the changes that the horse presents to her. And she's doing a real good job of not falling over. So she's using a lot of extra muscle that a typically developing child of her age would not be using. She's working really hard to not fall over and to stay centered on the horse. Sorry, I just wanted to.
Yeah, as we're watching, it's clear that she's becoming more fatigued. And
yes,
we do use the 30-minute mark as usually when we say that's about enough. But Nancy, you will take children off quicker
yes.
if you start noticing this. But her fatigue became more noticeable right here towards the end when you pointed it out. So you're getting ready to have her dismount?
Yes, and typically we will turn the child to face us and then help them to roll onto their belly and then help them slide off the horse. Winnie was pretty tired here, so I think I just turned her to face me and take her off without trying to put her through rolling her over because she was not going to be able to hold her head up to do that.
We're almost at the end of the video, but this is a pretty cool little wheelchair.
It's a tiny
wheelchair. We don't see those very often.
Which Winnie is independent in moving, but not on this footer. It's
right,
too
right,
pushy.
yeah.
But she does move herself around independently, and she
with the wheelchair.
Yeah.
Well, I guess we're about at the end of the video, but thank you, Nancy,
You're
for
very welcome.
your commentary. It was a lot of fun. It was our first experience together as a interviewee. So, all right, so you guys will have some things to work on after viewing this video, and you can check that out on your eCampus site. Thank you.
She has whiskers like a cat. Yeah. Actually, all mammals. We're going to try to do this. Including dogs. Hey, let's say thank you to everybody. Good job today, Winnie. Not very bumpy. I don't know. We'll probably put a bumpy. It is pretty bumpy.